You feel fine. No headache, no chest tightness, nothing that would make you think anything's wrong. And that's exactly the problem. Because high blood pressure has earned a nickname among doctors for a reason, the silent one. It can sit elevated for years, quietly straining your heart, your arteries, and your brain, without a single symptom to warn you it's happening. Here's what almost nobody explains clearly. The way most people manage blood pressure, cut the salt, take the pill, check it if you remember, misses several of the pieces that actually move the number the most. Some of what actually matters has almost nothing to do with salt at all. Today, I'm going to walk you through 7 habits that genuinely support healthy blood pressure, ranked from a simple first step to the one I consider the real reason this whole topic deserves more attention than it usually gets. Number 1, the last one, explains exactly why feeling fine can't be trusted here, and it ties every other habit on this list together. So stick with me for that one. Quick note before we start. This is general education, not medical advice. Never adjust, olay, or stop any blood pressure medication without talking to your doctor first, even if your numbers look good, since that can be genuinely dangerous. All right, let's get into what actually moves this number. And tell me in the comments, do you check your blood pressure regularly at home, or mostly just at doctor visits? I read every comment, and where you land might surprise you. Let's start with number 7, a skill most people assume they already have, but often don't. Coming in at number 7 is something almost nobody gets taught properly, how to actually take an accurate blood pressure reading at home, since small mistakes in technique can throw the number off more than people realize. Here's why this matters so much. A handful of very common habits can artificially raise a reading. Talking during the measurement, having a full bladder, crossing your legs, or using a cuff that's the wrong size for your arm can each push the number up by a meaningful amount. Sometimes enough to make a genuinely normal reading look concerning, or mask one that actually needs attention. If your technique varies from one reading to the next, it becomes very hard to trust the trend over time, which is really what matters most. Here's how to build the habit. Sit quietly for 5 minutes before measuring, with your back supported and both feet flat on the floor, uncrossed. Rest your arm on a table so the cuff sits roughly at heart height, and stay silent during the reading itself. Use the bathroom beforehand if needed, and try to measure around the same time each day, since blood pressure naturally shifts somewhat throughout the day. A helpful tip: take 2 readings, a minute or 2 apart, and record the average rather than relying on a single number. This smooths out natural moment-to-moment variation and gives a more reliable picture. This is the perfect starting point for anyone who checks their pressure occasionally, but has never really thought about whether they're doing it right. Getting an accurate number is the foundation everything else on this list depends on. Now, number 6, something tied closely to balance and falls too. Number 6 is standing up slowly and deliberately, particularly first thing in the morning or after sitting for a while. Here's why this matters. When you stand up, gravity briefly pulls blood toward your legs, and your blood vessels normally constrict quickly to keep pressure steady to your brain. With age, and with certain blood pressure medications, that response can become slower or less reliable, causing a brief drop in blood pressure upon standing, something called orthostatic hypotension. This is what's behind that lightheaded, momentarily dizzy feeling some people get standing up too fast. And it's also a genuinely significant, often overlooked contributor to falls in older adults. Here's how to build the habit. When getting up from bed, sit on the edge for a few seconds before standing, giving your circulation a moment to adjust. When rising from a chair or couch, pause briefly, holding on to something sturdy before walking off. If you regularly feel dizzy on standing, that's worth specifically mentioning to your doctor, since it can sometimes point to a medication dose that needs adjusting. A helpful tip: this dizziness tends to be most pronounced first thing in the morning and after meals, so those are the 2 moments worth being most deliberate about. This matters enormously for anyone who's felt that brief head rush standing up, or who's had a close call catching their balance after getting up quickly. It's a genuine blood pressure issue, not just clumsiness. If this connection was new to you, tap that like button. It helps this reach more people who felt exactly this. Now, number 5, and this reframes the salt conversation entirely. Number 5 is paying as much attention to potassium-rich foods as you do to cutting back on sodium, since the relationship between the two matters more than sodium alone. Here's why this is so often missed. Most blood pressure advice focuses entirely on reducing sodium, and that's genuinely useful, but it's only half the picture. Potassium helps your body balance out sodium's effect and helps relax blood vessel walls. And research suggests that the ratio between the two may matter as much as the sodium number by itself. Many people successfully cut back on salt, but never increase potassium at all, leaving a real piece of the equation untouched. Here's how to use this. Alongside continuing to watch sodium in processed foods, canned soups, and restaurant meals, deliberately add potassium-rich foods regularly. Bananas, potatoes with the skin, spinach, beans, and yogurt are all strong sources. A helpful mental shortcut is to think of meals as add potassium opportunities, not just subtract sodium ones. A helpful tip: if you take a medication that affects potassium levels, such as certain blood pressure medications or diuretics, please check with your doctor before significantly increasing potassium-rich foods or any potassium supplement, since the right balance depends on your specific prescriptions. This is valuable for anyone who's already cutting back on salt but hasn't seen the number move as much as expected. Potassium may be the missing half. Now, number 4, and this one is a conversation worth having, not a change to make on your own. Number 4 is bringing up medication timing specifically as a question for your doctor, rather than assuming the time of day you take a pill doesn't matter. Here's why this deserves a real conversation. Blood pressure naturally follows its own daily rhythm, generally dipping at night and rising in the morning hours. And some research has explored whether the timing of certain blood pressure medications, relative to that rhythm, might influence how well they control pressure around the clock. The research in this area is still evolving and doesn't point to one single answer for everyone, which is exactly why this is a question for your prescribing doctor, who can weigh it against your specific medication and health history, rather than something to change on your own. Here's how to use this. At your next appointment or pharmacy check-in, simply ask, does the timing of when I take this matter, and is there a time of day that might work better for me? This is a completely reasonable, well-informed question that invites a real conversation rather than guesswork. A helpful tip: whatever timing you land on, taking it at a consistent time every day matters more than which specific time you choose, since consistency helps maintain steady levels in your system. This is worth raising for anyone on blood pressure medication who's never actually discussed timing with their doctor. It's a simple question that's rarely asked, but any doctor will be glad you did. We're nearing the top of the list, but before number 3, if you're finding this useful, consider subscribing. I dig into these overlooked angles on senior health regularly. Number 3 is being honest with yourself about alcohol's effect on blood pressure, since even moderate drinking tends to have more impact than most people assume, and that effect can grow with age. Here's why this matters. Alcohol can cause a temporary rise in blood pressure with each drink, but regularly drinking more than a modest amount is associated with a sustained increase over time, not just a short-term spike. And here's the part that surprises people. The amount of alcohol that affected blood pressure minimally at 40 may have a noticeably larger effect at 70, since the body processes and responds to alcohol differently with age, even at the exact same amount someone has always had. Here's how to use this. If you drink, general guidance points towards staying within 1 drink a day for women and up to 2 for men, though your own healthy amount may be lower depending on your specific health picture and medications. If you've noticed your usual amount doesn't sit the same way it used to, or your numbers have crept up, that's worth genuinely reflecting on, not dismissing as coincidence. A helpful tip: if you're curious whether alcohol is playing a role for you specifically, a few weeks of noticeably less, tracked alongside your home blood pressure readings, can show you a real answer rather than a guess. This matters for anyone who's never really connected their evening glass of wine or beer to their blood pressure numbers at all. It's worth a closer, honest look. Now, number 2, and this one happens in real time, whether you notice it or not. Number 2 is building a genuine regular practice for managing stress, because of the very direct way it moves blood pressure, both in the moment and over time. Here's why this is so powerful. In the short term, stress triggers a surge of hormones like adrenaline that raise your heart rate and tighten blood vessels, producing a real, measurable spike in blood pressure right in the moment, which is exactly why a stressful doctor's visit alone can sometimes produce a higher reading than your true baseline. But when stress becomes chronic rather than occasional, those repeated spikes appear to contribute to a higher sustained baseline over time, not just isolated moments of elevation. Here's how to use this. Build a real, regular outlet for stress into your routine, not just something you turn to during a crisis. Slow breathing exercises, a daily walk, time in a garden, prayer or meditation, or simply a standing habit of talking through what's weighing on you with someone you trust. Consistency matters more than finding the perfect method. A helpful tip: if you notice your home readings run consistently higher right after something stressful happens, that's useful information. Not proof something's wrong, but a clear signal of how directly your stress and your numbers are connected for you specifically. This matters for anyone who's never thought of stress management as blood pressure care. Specifically, it genuinely is, in a very direct, physical way. And now, the moment we've been building toward. Number 1. The reason this whole topic deserves more attention than it gets. Here it is. Number 1, and the single idea I want you to walk away with more than any other. You genuinely cannot feel your blood pressure, which means "I feel fine" is one of the least reliable signals you have for this particular number. If you take only one thing from this video, let it be this. Here's why this changes everything. Unlike a joint that hurts or an appetite that's changed, elevated blood pressure typically produces no noticeable symptoms at all until it's already caused real damage to your heart, your arteries, your kidneys, or your brain. This is exactly why regular, accurate monitoring, the very first habit on this list, is not a minor detail. It's the only real way to know what's actually happening, since your body simply won't reliably tell you on its own. Every other habit we've covered, correct technique, rising slowly, potassium, medication timing, alcohol, stress, all matter, but none of them replace actually looking at the number regularly and honestly. Here's how to use this. Make home monitoring a genuine routine, not just something for when you happen to feel unwell, a few times a week, at a consistent time, using the correct technique from earlier in this video. Keep a simple written or app-based log so you and your doctor can see the trend over weeks and months, which tells a far more useful story than any single reading. And resist the temptation to only check when something feels off, since by definition, this condition often gives you nothing to feel. A helpful tip: bring your log to every doctor's appointment, even if nothing has seemed unusual. A steady trend over months is some of the most valuable information you can hand your doctor, and it's information only you can provide. This final point is the one I want to stick with you most. Don't let feeling fine be the reason you stop paying attention. With blood pressure, feeling fine and being fine are not always the same thing, and the only way to know for sure is to actually check. So there you have it, 7 habits, from learning to measure correctly all the way to remembering that this number can't be felt, only checked. Accurate home measurement, rising slowly to protect against dizzy spells, thinking potassium alongside sodium, asking about medication timing, respecting alcohol's real effect, managing stress directly, and finally, treating regular monitoring as non-negotiable because you simply can't feel this one coming. Here's what I want you to remember most. You don't need to tackle all 7 today. Pick just one, maybe finally buying a home monitor or sitting quietly for 5 minutes before your next reading, and build from there. These habits work together, so steady progress in one area tends to support the others. And please, never adjust, skip, or stop a blood pressure medication on your own, even if your home readings look great. That decision belongs with your doctor, who can see the full picture. If you ever feel severe symptoms like chest pain, sudden confusion, or trouble speaking, that's an emergency. Please seek help immediately. Now I'd love to hear from you. Which of these 7 was new information for you? And do you check your blood pressure regularly? Or is this the nudge you needed to start? Tell me in the comments. I read every one. If this video helped you, please give it a like, share it with someone who could use a better handle on their numbers, and subscribe so you don't miss the next one. Check it, don't guess it, and take good care of yourself. Thank you so much for watching, and I'll see you in the next one.